sterile tray for the catheterization procedure. He's now washing his hands and he's making it very obvious to the examiner. And now he's applied his first set of gloves for the first phase of the male catheterization procedure. The catheter pack will come with some saline, which you can place into the plastic cup as is shown here. The clinical waste bag, very important, so remove the small plastic strip that you can see here that the candidate is demonstrating. And then you will stick this at the end of your tray, and again that will mean you have easy access to this and you can easily dispose of any waste material that accumulates, and lots of it will accumulate during the male catheterization procedure. Now there's your KY gel. That will be very useful later on, so that's placed onto the sterile field. Notice the candidate is trying his absolute best not to touch that sterile field. The next phase, again, you've got a catheter which comes in a big pack, and then of course a smaller pack which surrounds the catheter, and you drop that onto your sterile field. The next step is about patient dignity and also allowing you to focus on the area that you will be doing the procedure. So you take the plastic sheet and you make a small hole in the middle of this sheet as demonstrated by this candidate. The head of the penis can then be gently guided through, and now you can see the area which you're going to be working on, and that first pair of gloves has now been removed, and the candidate is taking the sterile gloves from the catheter pack and applying them at this stage. Okay, so now the candidate has moved on to cleaning the area, so he's given it one clean in one loop and disposed of the swab. He's now taking the second bit of saline, another loop, and he's thrown the second gauze away. He's now moving on to the third one, and again, nice circular loop over the tip of the penis and the urethral orifice. Now this stage is where the KY gel is inserted into the urethral orifice, so you should clearly explain to the patient that it may feel uncomfortable and to let you know if there's any problems. So that has safely gone in, and that will make it easier for you to insert the catheter when you go on to the catheter procedure. Now the catheterization, so this is the important bit. So the candidate has now placed the bottom end of the catheter into the bucket to make sure that if any urine does come out, it will drain into the bucket rather than on the bed. And you can see the penis has been slightly lifted and the candidate is carefully inserting the catheter, trying to make sure the procedure remains as sterile as possible, and of course also clearly explaining to the patient that this may feel uncomfortable. If you do get any pain or discomfort, please let me know. Now this procedure can be difficult because remember, you will be doing it on a mannequin. In real male patients, it can be a lot easier and less resistance can be found than, of course, when you get the type of resistance that you get with a mannequin. So the candidate is still going, he's checking, and he's still looking for any urine to come out of the other end. Nothing has come out at this stage. And now the candidate has placed the catheter in a little bit more, and you can see he's now getting some urine coming from the mannequin. And this is all going straight into the basket, which is for hygiene reasons. And he's demonstrating that for the examiner. Okay. Now at this stage, you will then remove the plastic covering over the catheter and dispose of that, or place it aside from your sterile field. And gently, some candidates may insert it another sort of perhaps half a centimetre in to make sure you're definitely in the bladder. And then you move on to the next stage. Now, the catheter bag, which again the candidate has already prepared, you remove the plastic cap at the end and you insert it into the rubbery side of the catheter, and you Gently apply some pressure and really sort of secure it into place. The next stage is to take your saline and attach it onto the syringe holder on the other side of the catheter, and you can clearly see it fits in, and the saline has easily gone in, and dispose of that in your clinical waste bag. And then good candidates will then just do a gentle pull on the catheter to make sure that the balloon is in place. You can now see that the urine is slowly starting to drain into the catheter bag, which you will place on the side of the patient's bed. Normally there will be a small clip which can be clipped onto the bed. Remove the paper sheet and remove all of your waste and place it into the clinical waste bag and remove your trolley, and then thank the patient.